diseases or foodborne illnesses is any illness resulting from the ingestion of contaminated food, which is contaminated by pathogenic bacteria, viruses or parasites, or maybe prions, especially the agents of mad cow disease, and toxins such as aflatoxins in peanuts, poisonous mushrooms. So based on the immune response of the body and prior exposure to that specific toxic substance or pathogen, the effect of foodborne illnesses can vary. Symptoms vary depending on the cause. For example, if there are, after the bouts of the vomiting, some microbes may even stay in the intestine and causing more pathogenicity. Causes can be pathogenic bacteria, fungi, viruses, chemicals such as pesticides, medicines, natural toxic substances such as vomitoxins, poisonous mushrooms or reef fish. Vomitoxins are nothing but they are the secondary metabolites of mycotoxins, and reef fishes are those which are found in the coral reefs. And second cause can be of improper handling, preparing and food storage. Based on the cause, foodborne diseases can be classified into three: infection, intoxication and toxico-infections. So food infections are due to the ingestion of contaminated food containing live cells into the body. So it is having longer incubation period and body reacts to it mainly by high temperature, example fever. Second one is intoxication. Intoxications is consumption of food containing the toxins produced by the microorganism, and for example staphylococcal intoxications. Third one is toxico-infection. As the name suggests, it is food contaminated with both live cells and toxins are formed after it has entered our body. So serious one will cause allergic reactions. Now we are going to discuss 4 different types of foodborne diseases which is caused by bacteria. First one is staphylococcal intoxication. So staphylococcal intoxication is an acute intoxication which is caused by the organism Staphylococcus aureus. Now Staphylococcus aureus, as we all know, it is a gram-positive cocci which is found in a cluster like a grape shape. So it is an acute intoxication which enters the body and it produces an enterotoxins or exotoxin. And this enterotoxin is heat labile or heat stable and it is resistant to many proteolytic enzymes such as renin, casein, etc. And other infections caused by Staphylococcus aureus are skin infections, lungs, especially pneumonia, heart, endocarditis, etc. The common symptoms include vomiting, nausea, diarrhea, usually watery but sometimes with bloody stools, cramps, and other symptoms may include fever, chills, weakness and dizziness, and the symptoms will occur after 1 to 10 hours after the exposure to the performed toxin, and it go away in 1 to 2 days. In some cases this can become fatal. Causes can be of 2 conditions should be required. First one is presence of the Staphylococcus aureus in the food, and second one is improper storage with the specific time and temperature. So for the growth and for the toxin production, the food should be stored. The food stored in the specific time and temperature plays a critical role. So even though it is found in animals and raw food, the main reservoir is humans. So Staphylococcus aureus, as we all know, it is a normal flora found in our skin, nasal cavity and mucous membrane, and humans are the main reservoirs. And food contamination routes are food handlers through their skin contact or coughing and sneezing, or through cross contamination during preparations, Growth and toxin production. The growth range of the toxin can be between 7 to 48 degrees Celsius, where the toxin will get produced, and optimum 37 degrees Celsius, and enterotoxins will get produced only if there is greater than 10,000 bacteria per gram of food. And common implicated foods are poultry, cooked meats such as ham, corned beef, which are like the ready to eat meat, and milk and dairy products, and canned foods and bakery products. Treatments and drugs, which most people which recover without treatment within 1 to 2 days, and the administration of fluid is recommended by doctors if the diarrhea or vomiting persist after 2 days, and antibiotics are not generally prescribed because the symptoms are caused by the enterotoxins and not by the bacteria. For the control measures, good hygienic practices has to be followed. The food handlers has to put PPE, proper PPE, that is protective clothing, gloves and hand washing should be done. They should cover the skin lesions or exclude infected handlers, and cross contamination should be prevented. Raw food and cooked food should be separated, and the surfaces has to get cleaned every now and then. For the prevention of growth and toxin formation, food should be kept above 60 degrees Celsius at hot condition or below 4 degrees Celsius at cold conditions. So this is the pathway of pathogenicity. So first, cooked or processed food contaminated with Staphylococcus aureus, in that in the appropriate temperature and time, toxin or exotoxin will get produced, which is heat stable. And if we consume the food containing the toxin, first the staphylococcal enterotoxin binds to the submucosal mast cells in our body, and then which releases the 5-HT. Now this 5-HT will bind to the specific receptors on the stomach on vagus nerve ending, and this will stimulate the vomiting center in our medulla oblongata brain, and which will induce the vomiting within 30 minutes to 8 hours, between 3 hours. Next disease, foodborne disease, is botulism. So botulism, which is caused by the Clostridium botulinum. Clostridium botulinum is a gram-positive, rod-shaped, spore-forming bacterium, and it is an obligate anaerobe. Botulism is a flaccid paralytic disease which produces a neurotoxin, which is a fatal toxin. And coming to the history of it, in 1793, Justinus Kerner was the first person to name the botulism as worst gift, and botulus, the name came from the Latin word that is for sausage. So in older times, sausage was made by stuffing the pig's stomach with meat and blood and cooking them and then keeping it in refrigeration, and these were the ideal conditions for the toxins to get produced, or the neurotoxins to get produced. So 1895, Emil von Ermengem was the first one to isolate the organism during the Belgium outbreak of botulism. But Clostridium botulinum, even though they are obligate anaerobe, they can tolerate traces of oxygen due to an enzyme present in them, that is superoxide dismutase, which is an antioxidant defense. And as we said, it produces a neurotoxin which will grow in anaerobic condition during the sporulation stage, which is a most potent toxin, and lethal dose of which is 1.3 to 2.1 nanogram per kilogram in human. And Clostridium botulinum is mainly associated with the bulging of canned food, and this bulging can be due to the internal pressure due to the gas formed by these organisms, and leads to the bulging of the canned food. And asparagus, green beans, baked potatoes are all associated with the type A serotype of this neurotoxin. And fermented fish, improperly fermented fish, is associated with type E strain of this neurotoxin. And C. botulinum is usually found in canned meat, luncheon meats and fish, and it is having 4 distinct phenotypic groups, 1 to 4, and classified into 7 serotypes A to G based on the antigenicity of the botulinum toxin produced. So A, B, E, F and H causes diseases in human, and in them type A, B and E are associated with foodborne illness. And we have discussed that type E is associated with improperly fermented food, fish products, and type C produces limber neck in birds, which is their neck will go in a drooping manner, and type D causes botulism in other mammals. This is the picture of the limber neck in birds. Toxin can be destroyed by boiling in specific high temperature, and symptoms include double vision, inability to swallow, paralysis of respiratory system, speech difficulty, and in severe cases it can become fatal, death. Onset of symptoms occur 4 to 36 hours maximum after the contaminated food is consumed. So this is a graph which depicts the foodborne botulism cases in US from 1982 to 2002. We can see that the outbreak first, which caused in between 1982 and 87 due to sauteed onion consumption, which is contaminated. Second one is due to fish or seafood products, then baked potatoes and chili sauce. Treatment, mainly this clinical signs can be observed by serum the serum contains the toxin, so serum, stool, gastric aspirate, and if we get the suspected food, it is more proper. Then culturing of the stool or gastric aspirate can be done, which will take up to 5 to 7 days. Now that diagnostics use electromyography, and most common one is mouse neutralization test, which will give result in 48 hours. So this mouse neutralization test is nothing but will ingest the serum consisting of this toxin to the mouse, and will see the clinical signs. Thereby we diagnose it as a neurotoxin. Now intensive care should give immediately. In the case of, we have seen that the symptoms mainly include paralysis of the respiratory system, so ventilator support should be given immediately. Then botulinum antitoxin can be given, which is derived from the equine source, and CDC will distribute it, used on a case by case basis. So as the name indicate, equine, it is an antibody which is derived from the horses. And second one is botulism immune globulin, and infant cases of type A and G is considered. For the prevention and control, children below 1 year of age are not prescribed or not suggested to give honey, because we know that honey is not properly pasteurized, or it is not properly processed before consuming. So honey, do not feed honey to children below 1 year of age. Then food should be stored in proper time and temperature and pressure, and mainly 80 degrees Celsius for 30 minutes or 100 degrees Celsius for 10 minutes. And refrigeration should be done, and boil the foods for at least 10 minutes. And for the decontamination, the suspected food has to be boiled before discarding, and utensils should be cleaned with chlorine, or you should boil them. Next disease is salmonellosis. So salmonellosis is an infection which is caused by mainly the salmonella bacteria, and it is a gastrointestinal tract infection which usually associated with eating feces contaminated food. So salmonella is gram negative, facultatively anaerobic, meaning they can live in and presence or absence of oxygen, and it lives